Welcome to the Regional Health Solutions podcast, powered by Statum.
We're your hosts, William Munt and Jaden Frame. In this episode of Regional Health Solutions, we have an inspiring conversation with Dr Rolf Gomes, founder and director of Heart of Australia. Rolf is a passionate advocate for improving access to specialist healthcare in rural and remote communities. Through Heart of Australia, he has pioneered the use of mobile medical clinics to deliver life-saving diagnostic and specialist services to people in regional and rural Australia who would otherwise have to travel long distances for care. In this conversation recorded in late 2024, Rolf shares his story behind Heart of Australia, how it started and the impact of these programs on the regional rural communities. He explains logistics and innovation behind his fleet of mobile medical clinics, the economic and social benefits of delivering healthcare locally. Rolf highlights the importance of partnerships, from government support to corporate sponsorships and community engagement, to ensure the sustainability of healthcare in regional rural Australia. Heart of Australia is transforming the way healthcare is delivered in our regional rural centres. With Rolf's insight into innovation, logistics and patient-centred care, it makes for a compelling discussion. We hope you enjoy this episode.
We're here with Rolf Gomes from Heart of Australia. Rolf, thanks for joining us.
Pleasure.
Mate, you're a dynamo in the Queensland rural health space. Before we kick off with some more in-depth questions, this might be an obvious place to start with taking us through the vision and what Heart of Australia do and has done.
Yeah, I'm not sure about a dynamo, but I'll take it. Heart of Australia was really an idea which entered my head probably around 2010 as a junior doctor out in the bush, where they send you for a few rotations at the coalface, getting to really experience the challenges and the difficulty in accessing healthcare. At that stage, I was fairly committed to training in cardiology. Thought it'd be nice to contribute in a professional capacity someday to help bridge this gap. And as a cardiologist, talking to people with chest pain, ultimately you need to put them on a treadmill, get an ultrasound scan of their heart. None of those things you can stick in a suitcase and on a plane. So how are we going to find myself, not just with my stethoscope, but my entire toolbox out in the regions, so you can sort of take the story, listen to the patient's chest, and then if they need to have a stress test, for example, not filling in a referral form and saying, well, that's going to mean a 3-day round trip for you to run on a treadmill for 9 minutes. But instead you can say, why don't you step in the room next door, and you can close that loop very quickly from symptom diagnosis, treatment, and save the patient an enormous amount of time, stress, money, and hopefully save some lives in the process.
Rolf, you really, over the last 10 years, breaking the model of rural and regional health, the way you deliver your health services in the region. And we'll go into some of those in a minute. You've just celebrated your 10-year anniversary. The next 10 years in regional rural health, where do you see that?
My feeling, and this isn't really a new idea, new feeling, it's been there for some time, is that when we look at how we approach delivery of regional healthcare, being a specialist, especially in the specialist area, there's never been a sustainable, strategic approach to doing that. I certainly have colleagues who've done a fantastic job as individuals servicing these regional communities, but the problem is at some stage they retire, city practices get too big, and you end up chasing your tail. So you go around to some of these communities and they say, well, we used to have a gynecologist who visits, but then they retired, or an ophthalmologist and their wife got ill, or their city practice got too busy, they stopped coming. So the Heart of Australia vision in its grander scale is to create a strategic framework, a brand, a focus, which in the fullness of time can become the go-to service, where if you want to deliver services to regional Queensland or the country, in fact, here's an organisation you can pick up the phone and it becomes plug and play. So with that, the benefits that approach offers is you can plan, can have sustainability in the workforce, and you can build some proper funding sustainability in it. You have a united voice to advocate to governments, to other agencies. So it's a lot grander in its long-term sustainability vision than the individual approach.
Is there a ceiling to that model of care that you see, knowing that it started as cardiology primarily? I know that you've ventured into the psychology and psychiatry space, and probably what I'm asking is where is the ceiling to that, or is there no ceiling? You could actually have a fully packaged clinical model of care that services rurally in a mobile way.
I don't think there's any obvious ceilings. I mean, we started with cardiology. Myself being a cardiologist, it was a good place to start. But really, when you look at the presence or the lack of presence of specialists in regional Australia, there's not much there. So it's a question of how do we not just bring the people, but bring the diagnostic infrastructure out into these regions. And so you're left with two options when it comes to that infrastructure. Either we commit to building bricks and mortar type facilities, and when you turn up once a month, you wipe the dust off the equipment and hope it works. Or we say to patients, well, look, you're going to have to travel. What the Heart of Australia model does is it's a bridging option where once a month you have access to a state-of-the-art facility, which is well utilised, gets a lot of service through it, so the clinical rooms, etc., are all up to scratch. And there's also familiarity of the environment for the specialists. So it seems to work. Over the years, we've had a lot of clinician interest. So we started off with 3 specialists, which has grown to over 30 specialists now. Most of the recent ones are not people I've known in the past. They've just contacted us via email or phone call saying, we've heard about the program, how do we get involved? So it's really being transformed now into an engagement platform where they can plug and play. And, similar to where we look at something like Uber, where you don't want to own your own taxi, but you have a resource which you'd like to unlock. Whereas, so Heart of Australia, now that we have the organisational framework, it's really tapping into that intention of clinicians to want to contribute to regional healthcare, removing all the logistical barriers. They don't have to worry about booking flights, accommodation, who's going to pick them up from the airport. They really can just go practice their craft by engaging with an organisation which does all the rest.
Rolf, going back to the sustainability question around regional and rural health, there's always an argument that if you want sustainability, and we believe increasing the livability of regional and rural Australia, you've got to improve your health sector because health underpins the livability of a region. There's a default to go to not-for-profits that you need to be a not-for-profit to be sustainable, but you're a private entity. Can you talk us through what your thoughts are and the benefits of that? Because it seems to be working really well.
Yeah, so and we did come to this fork in the road about 10 years ago where the option was to either become a not-for-profit or a private organisation. And really the benefits of being a private organisation and the ability to make decisions quickly, avoiding some of the board and the governance frameworks. We certainly our focus was in delivering services, not raising funds through charities. And really it was ultimately my own personal thoughts were that we're talking about essential services and shouldn't necessarily it's in the domain of charities to deliver. So if you're looking at a private structure, you have to demonstrate value for what you're delivering. And one of the things engaging with a private organisation does is it really questions the user or the buyer. Do they know what they want and what they're happy to pay for? And if there's value there and the service is delivered, then I think that's really what should matter, not whether it's being procured from a charity or a not-for-profit. For example, just say your printer breaks tomorrow. You go to Officeworks and you want to buy a new printer. Ultimately, you know, I want to spend $500. I want a color laserjet printer, and it has to deliver A3 or A4, and you're happy with the transaction. So, you know, similarly in healthcare, I think people don't understand what they're prepared to pay or good understanding of the cost, and forcing people to really ask that question, what is it we want delivered? What do we think is a fair price to pay is actually a good thing. It makes you think about the financial sustainability as well.
It's a
Great analogy.
Well, it's exciting. And the other difference of Heart of Australia, and I'm a huge advocate around collaboration and a collective impact organisation, that you partner with industry to help deliver these essential services in the region. Can you elaborate a little bit on how they see value and who you're partnering with and how that benefits Heart of Australia?
Yeah, so we've been very fortunate through our private partnerships. Ultimately, we're blessed in the sense that it's an easy story to tell. There are a lot of people out there. Everyone's got a heart. No one's getting younger. No one wants to die. So what we're going out there, and our mission is to give people in the country an equal chance of a long and healthy life. And we do that by making healthcare more accessible. Today it's trucks. Tomorrow it could be drones, could be telehealth. It doesn't really matter how we do it, but make healthcare more accessible. So, you know, whether you're a trucking company, whether you're a diesel company, whether you're an airline, ultimately customers all have an experience of health and all value health. So if you're partnering with an organisation which is looking after your constituents, then it's a good story to be a part of.
Absolutely. Have you found any barriers to being a private organisation? What are the challenges? It's a great thing to be involved with, but has it limited you anywhere?
Oh, look, from a fundraising perspective, it probably is a barrier. But again, it really challenges the person to ask, what are they hoping to achieve and what do they think is a fair price? If the first question we receive is, are you a not-for-profit? Then that's a little bit harder to deal with. If it's the 10th question on the ticker box and all the others seem to be easy to answer, then that's a different kettle of fish.
So you have been going for 10 years in Queensland, and recently you've announced your expansion nationally, which is exciting. But before we talk about that expansion and get a bit of a glimpse of what that could look like, the innovation piece that we see you continuously come up with innovative models of workforce, but the first battery-powered CT scanner globally to be on the back of a truck is pretty exciting. Where did you get the idea for that?
Well, just before I answer that, I mean, being a private organisation certainly helps you step on the accelerator when it comes to trying new things, innovation. The use of radiology in the day-to-day practice of medicine now is enormous. Essentially, you can only find what you can treat, and sometimes you need to just look inside a person's body to see if there's something there or not. Without X-ray vision, an X-ray machine. And bringing radiology out into regional Australia is almost like delivering penicillin. It's not underutilised technology. It's getting more and more relied on. So again, we're just trying to give people in the country an equal chance of that long and healthy life by allowing GPs the resources, the toolbox to help make the right diagnosis, get them on the right treatments, and follow them up appropriately. The battery-operated CT scanner is probably an idea which was influenced by having built 4 trucks before the battery-operated CT scanner. So, in the planning of that mobile medical clinic, it took 3 months, 5 electrical contractors trying to argue the case for a battery-operated CT scanner. But having run 4 trucks around where you knew the issues with generators, with heat, vibration, the difficulty and the limitations which would be enforced should we have had to have a dedicated power supply at the other end. There was only one way to go, and that was to have it completely mobile, which meant battery operated. And yes, we do have the world's first battery operated CT scanner, now patented in Australia and New Zealand recently. And the first battery operated CT scan was done in Queensland, which I think is amazing. It's been to over 70 sites, delivered almost 2,000 CTs. You can deliver as many CTs as you want in a day. The limiting factor is not the machine, it's the radiographer. So it's really taking mobile healthcare to a new level.
As a clinician, that's the sort of innovation that gets me excited, I have to admit. Change lanes for a second. I'm interested with, you used the printer analogy in private medicine and private entity altogether, and the customer having a known quantity of what they're buying. Talk government and public health, whether it's state or federal. I don't know if you can double down on the same analogy where we have publicly funded printing and ink, but where do they fit into this, and what benefits or impact are they seeing your model?
Well, I think essentially for what is essential services in regional areas. So if you take, for example, airlines, where we have essential transport infrastructure run by organisations which are not necessarily not-for-profits, but we recognise that to provide that equity, government has to invest in those arrangements. Similarly, where we're talking about essential health infrastructure, bearing in mind that, in a lot of the areas we go, we're not a choice of service, we are the only service. So talking about healthcare consumers, which implies a choice for people living in, say, Hughenden, 1,200 kilometres, 1,300 kilometres away from Brisbane, is a ridiculous concept where to imply that the patients have a choice. The choice to travel, well, I can tell you that there are a lot of patients who don't actually have that choice to travel. They're too frail. They're looking after loved ones. They don't have the economic circumstances to allow travel. They're too busy with their work. So this is, in a lot of the areas we go, the only accessible service for those people living in those regions. So again, I think government should invest in that if we really believe in equitable access to healthcare. If you're going to engage with a private company, obviously you need to have a good idea of what you're seeking to achieve and what you're happy to pay for it. There's always the element that as a private organisation, perhaps you don't have as much control over the entity. Again, you can put those safeguards in place. You can have those written into contractual terms. And we haven't had any difficulties fulfilling our government contracts to date.
And Rolf, this is where your model for delivering essential services in regional and rural Australia is, in my opinion, fantastic. Because if you have government investing in your service, which they do, you combine that with private industry funding, you get to do more, and the end consumer gets more. So it's empowering that government funding to provide more services to regional and rural, which I think is fantastic. I really want to unpick where your inspiration for innovation comes, because you're the type of guy that you can ring and Will and I hear challenges all over Queensland around how things can be differently, and dialing into you to say, hey, what's your thoughts? How does your brain work? Like you obviously think differently around health.
I suppose I think about things in a very practical sense, and that to some extent that's a legacy of being an engineer before being a doctor. Ultimately, you've got to build the thing and you've got to take that idea and create it. Especially even nowadays, if I find myself reading a document full of buzzwords, end-to-end solutions and those sort of things, phrases you often see, I keep asking myself, do I know what this looks like? And if someone was to ask me to build it tomorrow, could I do it? Would I know a starting point? So I think that clarity of thought where you're filtering what you're reading, what you're hearing, what you're seeing through a lens of can I actually construct this thing? Do I have a clear idea of what it looks like? It helps. Being a private organisation, you obviously have the capacity to take much greater risks, which if they work, such as the battery-operated CT scanner, they have enormous benefits to wider society. I think you have the decision-making time frame. For me, very few things take more than 48 hours for me to decide. And so where you might not have the fundraising capacity, being a not-for-profit or a charity, you have the agility of to make decisions quickly in an iterative manner where you can build something, try it, refine it, improve it. And that's been the Heart of Australia story.
So moving forward, the next 10 years, you've got the funding or support from the federal government. Can you give us a bit of a look under the covers around what that national expansion looks like?
Yeah, so this is very exciting, and no doubt we're very grateful for the Commonwealth for partnering with us to deliver the National Lung Cancer Screening Program. But really it comes back to a thought which crossed my mind back in 2011 when I read an article by the Bureau of Statistics called Health Outside Our Major Cities. And it said if you lived outside a city, you were 44% more likely to die of a heart attack. And when you look at the way technology is evolving, especially in medicine, at such a rapid rate, unless we can make this technology more accessible to people who live outside our cities, as the gap in access increases, so will the gap in outcomes. The National Lung Cancer Screening Program is a very good example of that, where we now have government supporting a national screening program to help with the earlier detection of lung cancer, which requires a CT scan. There's a lot of CT scans in the cities, but having just come from places like the Kimberleys, I was up in the Fitzroy Crossing last week, and Halls Creek and Derby, I can tell you they're a long way from a CT scanner. So how do we improve outcomes in lung cancer screening for people who live out in the regions unless we can improve access? And services like Heart of Australia, which will deliver to their doorstep state-of-the-art CT scanner where they can walk in, be screened for lung cancer and be home in half an hour, is going to make a huge difference. So I think technology has a very important role to play. If you think about the impact in general which medicine can have, it's a product of the availability and the accessibility. And if either of those is equal to zero, then the impact is zero. So it's an interesting theme. I mean, often these solutions occur in parallel with other innovation. So, for example, all our new trucks will be kitted with Starlink, which will now give us access to internet wherever we are. So as technology improves, and coming from an engineering background, I can tell you when it comes to technology, resistance is futile. It just sort of marches ahead. So the technology will eventually get there. It's just the willingness to take a few risks and to back things which work. I mean, we've celebrated our 10-year anniversary, and it's great that we are getting the support of the government to now bring this technology and these services to the rest of Australia.
What is that technology? Like, this might be a nebulous question, given that we don't know what we don't know in the next 5 or 10 years. But you mentioned drones before. AI is exponentially increasing. You don't have a crystal ball, but can you see some idea of what that looks like with the trucks and the service as a whole?
Well, I think technology and from a mobilisation aspect is interesting. Things like Starlink, battery technology, in terms of artificial intelligence, where we can look at how do we release ourselves from the reliance on human beings, which in the medical profession can be a very rare resource. Yeah. People say, take radiology, for example, where we can use AI to help us more accurately get to the best answer. I think there's huge potential. I think that drones in the transport of pathology samples. One of the things Heart of Australia is now recently commenced is delivery of clinical trials, making clinical trials more accessible to country Australians. Clinical trials, as an example, has essentially been inaccessible to people who live out of the city because of the requirement for these patients to be followed up. Here we now have the opportunity to give patients out in the bush access to innovative medicines, which will become tomorrow's treatments. There's still some challenges there with the transfer of pathology samples and blood tests in a timely fashions, and certainly drones, I think, have some potential there. AI, I would say, in refining thinking so that we have an extra layer of screening.
As we wrap up, I want to try and bring this back to just a personable level. And I'm going to put you on the spot. You've seen thousands, probably tens of thousands of patients. Can you think of one or two off the top of your head that Heart of Australia has potentially had the most impact on?
Well, I can think of two patients from just this week, actually. So this week we had our mobile CT truck for the first time in Palm Island, transferred on a barge to Palm Island, where we're running a community screening program. I think that program by the end of the week would have screened over 140 patients. So I was there Monday, Tuesday, Wednesday. I saw two patients, one which will almost certainly need an operation, and another one who's also just needs a fair bit of sorting out. Both of these patients had no idea they had an issue with their heart, but just very lucky to have turned up. So I think, bringing the service out to these communities, allowing them to have a coronary calcium score, which requires a CT, on the island without having to fly to Townsville, it would have been enormous benefit. The council loved it, the patients loved it, and they're hoping we come back.
Rolf, setting up a service such as Heart of Australia takes, like any new business, a lot of courage. And I want to thank you for your courage to set up Heart of Australia. Some people need the push or the leap to do this, and a quote that I've actually heard you use around setting up Heart of Australia was, "If not me, then who?" So thank you so much for your efforts and providing these services. And I know you're a busy guy, and giving us the time to talk about these things and learn and share has been very much appreciated.
Pleasure. Thank you, Jaden.
Stay connected with the conversation about enhancing livability through sustainable healthcare solutions for regional Australia. Visit statum.com.au/podcast to learn more, connect with us and join the movement towards a healthier future for our regional communities.